And now on the line is Majella Beattie from Care Champions. Majella, welcome to Near FM.
Thank you, Darren.
Majella, I got in touch with you today to talk about two issues in particular, and we will talk about them in a few minutes. As today is my first interview with you, though, Majella, could you start off by telling me more about who Care Champions are and how you became involved with them?
Okay, so Care Champions is a family-led advocacy group. We are families who have lived experience of care, be it home care, nursing home care, residential care, hospital care. Particularly during COVID, we formed together while we're recognising that there is an awful lot of good care out there. Our families have had a poor experience of care, and we want our experience to reform the system so that other people will not go through the sort of things that our families have gone through. And I suppose really that over the last couple of years we have been highlighting the lack of safeguarding laws, the lack of mandatory reporting, the lack of safety for residents in many care settings. And we've been lobbying government for change. We've been lobbying government for answers. Sadly, with COVID, many of our family members would have died alone and would have died in very poor and sometimes in very inhumane circumstances. And many of our families don't know what happened, and they are being denied access to records. They're being denied access to the truth of what happened in the final days of their loved one's life. They weren't there to hold a hand. Sometimes they were lucky if they got to look at their loved one dying through a window, and they don't know whether or not their loved one was in pain, whether or not they had received any human contact, really, leading up to it, because we know there was a staff crisis at the time. So our families need answers, because families have been left fractured and broken. And we are meeting a brick wall when we try to talk to government. So it's really important for our families that with the upcoming public inquiry, that its victims are at the heart of it, that it's human rights led and that it's independent. We can't learn lessons for the future unless we are going to go back and examine in a transparent way what was the lived experiences of the policy decisions that were made. I think it's pointless spending an enormous amount of money on a public inquiry if it's not going to actually go back and see what went wrong.
Okay, Majella, we'll come back to COVID in a couple of minutes. Just to talk a bit more about Care Champions in general for a second, do you advocate for people in care in general, or is it in certain areas?
We started out around window visits in nursing homes, but it developed as time went on. So our families now are families from disability residential services, families in hospitals, and those who are receiving or who are in need of home care. So it's kind of broadened. It's the issues that the lack of regulation and issues that they're the same across each sector of society. And, we really believe the government is failing people, and we believe that there's an issue around ageism and there's discrimination against those who have a disability or who are in need of some level of support to live at home, when oftentimes people are only given the option of a nursing home, even if they want to live in their own home. So I think it's all back down to human rights. I think as experts in lived experience, we're not professionals. We are using our experience to support others who are coming behind us, who need support to go through the complaint system, to go through highlighting concerns or getting support. Our complaint system presently is not fit for purpose. We have PICWA, who do not deal with individual concerns. We have the Ombudsman, who does not deal with clinical concerns. And we have the Office of the Confidential Recipient, who will only deal with concerns from HSE services, but yet 80% of our older people in nursing homes live in the private sector. So there is no fit-for-purpose one-stop shop for families to be able to navigate in order to highlight their concerns. And then over the course of COVID, we ended up supporting over 200 staff members to make protected disclosures, to highlight concerns that they've witnessed, or to ensure that their concerns were investigated appropriately.
I didn't know that 80% of elderly people that are in nursing homes are in private nursing homes, are they?
Yeah, the HSE only owns 20% of nursing homes.
Okay.
So it's the private sector that owns the majority, which is 80%.
Okay, when you cover all areas Care Champions do, would that include people with disabilities like mental health disabilities and dementia as well?
Well, absolutely, dementia. And, you know, basically anybody who is living in any residential setting who needs support, if we can help them, we will. We have never turned anybody away. If we don't have the expertise or the knowledge, we will try and find it for them, or we will direct them to somebody who does.
Okay, I just have one more issue before we talk a bit more about COVID. But we spoke about this yesterday on the phone when we were talking about this interview. But for the benefit of our listeners who don't know this, Majella, can you explain to our listeners that people in state residential care do not have a free ride in terms of their care, in terms of the financial cost of providing for their care every year?
So basically, people who live in nursing home care, either state funded or state provided, most people would fall under the Fair Deal scheme. Some people don't. Some people choose not to use the Fair Deal scheme. And, you know, nursing home costs on average is about €1,500 a week. It can be higher or lower depending on what part of the country you are in. But if you are going into care under the Fair Deal scheme, as a single person, 80% of your accessible funding, your accessible money each week, like be it from a pension, is that goes towards your care. So if you own a home and you're renting it out, 40% of the income you get from that also goes towards your care. You are allowed to have €36,000 in savings, but if you have anything over that, a percentage of that is taken each year for 3 years. They take 7.5% of your savings and then 7.5% of your home for 3 years. After 3 years, you don't pay any more on your principal home. So for many people who live in nursing homes, whose main income might be their old age pension, 80% of that is automatically discarded because it goes towards their care. And that would leave the typical person on the normal state pension with about €40 a week. And out of that, they would have to pay for activities. They would have to pay for laundry, hairdressing. That's not included in the 80% that they've taken.
I think that's outrageous. 80%. That's like the figures you just gave there about savings or whatever for 3 years. I think that doesn't sound bad, but like 80%. The only having 40 or 50 euro a week as an adult, 40 or 50 a week, and then having to spend more on top of that for toiletries and stuff. Like even if it was 50%, I'd be pretty shocked to hear that. But 80%, I think that's totally unfair. And I know in mental health centres, residential centres, like a lot of people smoke cigarettes, so you wouldn't be able to afford to buy a packet of cigarettes every day, wouldn't you know?
No, and you know, that's really important because people who live in nursing homes, they still have the same likes and dislikes as they always did, you know. And like, you know, many families, many people in nursing homes are relying on their family members to supplement their costs, you know, be it to pay to, like, activities can be anything from, and you have to pay for activities whether or not you participate in them. So if the activities that is provided are not to your liking, you are still obliged to pay for them because they are happening and you're choosing not to go. And that can range from anything from 40, 50 euro a month and more in some cases. If you don't have family members to either do your laundry, to wash their clothes, you have to pay for that. So you could be left with very little, or you could be left with not enough, and family members would have to come in to supplement that. But there are many people who live in care who don't have family members who can come in and supplement their weekly money.
Okay, Majella, you spoke for a couple of minutes already about COVID. Are you saying that like Care Champions was kind of established in the last couple of years during the COVID pandemic or around then? Or what's the story?
Yeah, Care Champions was established actually just before COVID because the HSE at that time had brought in an embargo on home care. So people who needed care to get out of hospital, or maybe somebody at home who might have needed something as small as maybe a half an hour care twice a day, were not getting it. So people were nearly being forced into nursing homes. So at that time, I had actually given up work to care for both my parents. I lost my father just before COVID, my mother during COVID. But at that time, thank you. But at that time, I was working 24 hours a day trying to care for my parents. My mother had dementia and delirium, and my father was very, very ill, and I was getting no support. So that is actually how I developed Care Champions. And very quickly, COVID happened in March 2020, and the nursing homes obviously closed down on the 6th of March, which we welcomed at the time, you know, because we didn't know much about COVID, and they were saying that nursing homes would close for 2 weeks. And, you know, we were like, okay, 2 weeks, keep everybody safe. But obviously, as we now know, it went on for longer and longer and longer. And it transpired then that people with dementia could not understand why their loved ones weren't coming in. There was people dying of loneliness. There was husbands and wives in nursing homes where they weren't allowed to see their other husband and wife. And yet, right across the world, like in Norway, for example, in summer of 2020, they brought in an essential caregiver role, which they saw the deterioration in their residents of not having their human right to family, and they saw an enormous deterioration. So only a couple of months after COVID began, they developed systems so that residents could see their loved ones safely. The similar happened in Northern Ireland, just up the road on our same island, by November 2020. So by November 2020 in Northern Ireland, everybody either in hospital or in a residential service had access to one family member, no matter the status of an outbreak or a virus. And that person was treated like a staff member. So they were tested with staff. They took all the precautions that staff took. And they also took pressure off the workload of staff because they were able to go in and maybe support their loved one to eat, apart from the emotional connection and the importance of that connection to their loved one. Well, here we are in 2023. We do not have care partners. And up and down the country today, there will be outbreaks from nursing homes where families are back standing at windows. So we believe, and we were highlighting these concerns, you know, as families who were horrifically impacted during the pandemic, we came together to say, don't let this happen to anybody else. We went to government, we went to NEPIT, we begged them to listen, we begged them to take on board the urgent need for safeguarding, the urgent need for connection, and the access to people's human rights. During many months in COVID, HICWA did not even do inspections. They stopped their inspections, so they closed the doors in a country that had a backlog of safeguarding concerns around the country. They closed the doors, and then the regulator did not go in. And people who live in a private nursing home or a private care facility does not have access to a safeguarding social worker. So for 80% of people who live in nursing homes, they do not have a legal right to a safeguarding social worker. A safeguarding social worker is a lead expert to investigate concerns of neglect or abuse. So we're now seeing the fruit of that when we're seeing reports after reports of heinous crimes that was committed against our older people. We have a care worker in jail, and we're seeing all the fruits of that now. But yet still, if I ring a safeguarding social worker that covers my area today, and I say the concern in X facility, that safeguarding social worker does not have a legal right of entry to go in and examine that concern.
Okay, and as well as people having access to social workers, and you already mentioned this, you believe everyone should have a care partner, don't you?
Absolutely. Care partner is hugely important. I think COVID should have taught us, in the section of society that saw the greatest loss of life, people died after prolonged periods of isolation from those that they loved. They were denied the right to spend time. They were denied the right to say their final goodbyes to people. They were denied the right to be told how loved they were and how important that they were. And while staff did the best that they could, staff are not family, but family are more than just visitors. Families are part of people's family. Most of us would say that our families are the most important things in our lives. And within Care Partner, and it has been proven where a similar program has been rolled out around the world, it did not increase infection because the people who live in care, we love them. We're not going to do anything to try and put them at risk. If there's an outbreak, we're going to be ultra cautious to make sure we bring nothing in.
Okay, Jackie, tell me what your plans are. Like, I know you're trying to deal with the Department of Health at the moment, the Minister for Health. Can you tell me what the plans are for the coming weeks or months? Because I believe you have a demo next month, don't you?
Yeah. So on the 24th of October, we're going, and we would love for people to come and support us. We're gathering at Dáil Éireann at 12 o'clock. And at 1 o'clock, we will start with a minute's silence for the people that we lost. We then have a couple of expert speakers. And the purpose of our day is that we have 5 key asks, which we believe the government must urgently act upon. One is to bring in mandatory reporting so that all staff are legally obliged to report neglect and abuse, and that they are protected in doing so, that they are not going to be penalised or lose their jobs for speaking up in order to protect people. We have no safeguarding laws for adults in this country. We have safeguarding laws for children, but after the age of 18, people who need support or people who are vulnerable because they live in a system where there is no legal protection for them, they are not afforded the same legal protections as the rest of society. It is disgraceful that the safeguarding legislation that has been worked on in the Shannon for many, many years has not yet been approved, is not yet law. So we believe, in the light of the recent Emily case and every other concern, it is past time. So we are demanding that government now implement safeguarding laws. We are demanding that the inquiry hears the voices of residents, people who survived COVID, Their lived experience has to be heard. The family's experience has to be heard. The staff experience has to be heard. We believe that families must be provided with a truth-telling process. Families must know what happened in the lead up to their loved one's death, and a care partner, which I've just explained. We believe that needs to come into that needs to be made law immediately. In light of we are being told that we are not far away from another pandemic, so we have to learn from COVID. COVID shone a light on weaknesses that was already in the system. So now we have a chance. And in memory of all the people who died, all our loved ones, we need to put safety nets in place that in their memory, nobody else will suffer like our loved ones did and like our families are now, where they're not able to move on.
Okay, Majella, have you got any feedback from Minister of Health Stephen Donnelly or Minister Mary Butler about what you're calling for?
Yeah, we met with Mary Butler. Minister Butler was the only member of government who ever met us. And that was after a lot of media pressure. It was just following, we've had a number of primetime and RT Investigate programmes over the past couple of years. And we had one in, I think it was June 2021. It was around that time. And following that was about care and COVID between wave 1, 2 and 3. And it highlighted how no lessons were learned. You know, when the horrific death happened in wave 1, there appears to have been no sit down to see, okay, how can we stop this level of suffering going forward? So following that, Minister Butler met with us. She listened to it. She was very kind. She was very nice. But she was very clear that she couldn't ensure that we would have a human rights inquiry. She couldn't she could not give us any commitment on any of the asks that we were putting forward. She did say, however, on the 3 homes that featured in that programme, that she would get HICWA to do an investigation on those 3 homes. So for many, many months, families fought to get access to the report that was done on that investigation. And we have never got that. What families eventually got was a totally redacted page, well, 3 pages, totally redacted. There was not one word in it that they could see. So that resulted in families becoming like little investigators, doing freedom of information, looking for parliamentary questions. And it was through that we've been able to highlight the facts, like in the recent prime time this year, a couple of months ago, where we saw the serious failures of all state bodies who failed a nursing home in wave 3, when we were able, through freedom of information, get access to the minutes of meetings that took place when that particular home was in crisis and half the residents died. And it took HICWA 13 days to go in, and it took the HSE 11 days to go in when they knew that people were dying. They went in too late.
Okay, so Majella, you're hoping that the demo you have next month is going to put more pressure on Minister Stephen Donnelly and Minister Mary Butler, yeah, to meet you again and to agree with your, well, not necessarily to meet you, but to agree with what you're calling for?
I think there is a duty on our Taoiseach to sit down with the families of the bereaved. Neither our present Taoiseach, Mr. Varadkar, or our previous Taoiseach, Micheál Martin, have ever given the courtesy to the families of the bereaved, the families of those who were neglected in some cases. They have never given us the courtesy of listening to what they've experienced. So we believe and we have always, opened the door to meetings. We are not in any way disruptive or challenging. We want to meet the ministers. We want to meet the people in authority, and we want to bring the solutions to the table. We have the solutions, because while we are not experts in specific areas, we are the experts of lived experience. There is nobody who knows the impact of policy decisions more than those who have lived and suffered because of them.